Hi, my name is Dr. Raja Adnan Ahmed and I am a psychiatrist working in UK. And I'm making this video series to explain some of the commonly asked questions which you might face when you go for an interview in UK. Remember, I'm not trying to give you any model answers. I'm trying to explain the theories and the understanding behind this question and what are they trying to ask you, so you can be in a better position to answer them. Every individual is different and they will answer this question according to their own understanding and their own knowledge and according to their own CV. Let us tackle one of the commonly asked questions. Tell us about a mistake that you have made. Now, this question can offset a lot of IMGs, and it could be difficult to sort of talk about mistakes because we may feel that they're trying to catch us, they're trying to find out if we are a safe doctor. But this question is actually not about catching you or trying to prove that you're not a safe doctor. This question is about understanding your professional behavior, that when you make a mistake, you understand your responsibility, that you admit the mistake, that you reflect on that mistake, that you learn from that mistake, and then you make sure that you don't make that mistake again. So for example, a wrong way to answer this question would be that you may say that I've never made a mistake in my life, because we all understand that as doctors we are prone to make mistakes and we will make mistakes through different stages of our career. Another wrong way to answer is that you put blame on somebody else. You tell them a story or a scenario where you say, well, actually I was doing everything right, but it was the other doctor who made the mistake, or it was the pharmacist, or it was a nurse who was not listening to me. So I think that's also be mindful that don't put blame on others. It's about your understanding of making a mistake and how do you deal with that afterwards. So let us tackle a common example. So for example, you were asked to send a patient for a scan and you actually send the wrong patient for a scan. So what went wrong there and what can you learn from that? So first of all, you need to understand that if that mistake has been made, you need to go to the patient and admit them, apologize. And if it's the family involved, you need to apologize to the family. Then the second step would be to actually make sure to understand that why this mistake happened, sort of reflect on it and reflect on what can you learn from it and how can you make sure that you will not make this mistake again. So for example, there may be another patient with a similar name on your ward, that's why you made a mistake, or you were not concentrating enough when you were asked to arrange a scan. So you can make those reflective notes and make sure that you put in place some measures that will lead to this mistakes not happening again. Regarding mistakes and when things go wrong, there's a thing called duty of candor. I think this is something which we should all learn about when we are coming to work in UK, because duty of candor is a legal and professional responsibility of all healthcare professionals, and it basically states that when things go wrong, when we make mistakes, it is our responsibility to admit them. It is our responsibility to try to put things right as much as possible, and it's our responsibility to make sure that we reflect and we don't repeat those mistakes. So please read about the duty of candor, and that can lead to better understanding of this question and how to answer that. So in summary, everybody makes mistakes, but a professional doctor would have the courage to admit those mistakes, reflect on that mistake, learn from this mistake, and make sure that they will not make those mistakes again. So I would recommend that when you are going for an interview, please have an example ready. Think about your career and think about any mistakes that you have made, and don't be shy to share them, and don't be shy to share your reflection of what you learned from them. Thank you very much. I hope this was useful, and we will tackle another commonly asked question in the next video. Thank you.